Hi there, happy Tuesday. I hope that your week is off to a lovely start. My name is Olivia and I'm an employee benefits consultant based in Phoenix, Arizona. I've made an ABCs of employee benefits. We are on M, and M is for Mental Health Parity and Addiction Equity Act, or MHPAEA. In 1996, the Mental Health Parity Act was passed, and it stated that large group health plans cannot impose annual or lifetime limits on mental health care that is more restrictive than the limits that exist for physical health care. And then in 2008, the MHPAEA expanded upon this to extend to substance use disorders as well. This law reflects our current society's understanding that mental health is just as important as physical health, and it aims to reduce stigma and improve access to care. The law requires that large group health plans treat mental health and substance use benefits equally to medical and surgical benefits in terms of financial requirements like copays and deductibles, things like yearly visit limits, drug tiers, prior authorization requirements, as well as out-of-network coverage. So for example, if your plan covers doctor's visits or prescriptions with a $30 copay, they can't charge more simply because that visit or that medication is therapy or treatment for a mental health issue. This is a federal law and it applies to groups with 50 or more employees. However, there are some states that have their own parity laws that affect groups smaller than 50 employees as well. If you are an employer, as your company grows and as your team grows, so do your compliance responsibilities. That's why it's important to stay on top of laws like these, or to work with a team that specializes in understanding regulations and advising you on compliance.
Have a great day. Bye.